Welcome to the SVG-TV news for Monday, October 18th. I'm Khalil Kato with the details. 103 positive COVID-19 cases were reported from 707 samples collected on Thursday, October 7th, resulting in a positivity rate of 14.6%. 4 of the new cases were imported. 14 positive rapid antigen cases were also reported from flu clinics on October 7th. An additional 98 new cases were reported from 481 samples collected on Friday, October 8th, resulting in a positivity rate of 20.4%. One of the new cases was detected during exit screening. 35 positive rapid antigen cases were reported from flu clinics from the same date. Meanwhile, 4 positive cases were reported from 179 samples collected on Saturday, resulting in a positivity rate of 2.2%. 11 rapid antigen positive cases were reported. The National Emergency Management Organization says there are currently 8 patients admitted for COVID-19 at the Argyle Isolation Facility. All are unvaccinated. 30 patients have also been admitted to the COVID-19 wards at the Milton Cato Memorial Hospital, 28 of which are unvaccinated and 2 are partially vaccinated. 5 additional COVID-19 deaths have also been recorded. The victims are an 81-year-old female who tested positive on September 26th, was admitted to the COVID ward at the Milton Cato Memorial Hospital and died on October 11th. A 72-year-old female who tested positive on October 9th was admitted to the COVID ward at the hospital and died on October 10th. A 93-year-old female who tested positive on October 11th died at home on October 14th. A 64-year-old male who tested positive on October 5th was admitted to the COVID ward at the hospital and died on October 15th. And a 57-year-old male who died on October 13th tested positive for COVID-19 during post-mortem testing. In its news release, NEMO said all of the patients died of COVID-19 pneumonia, they had underlying conditions and were unvaccinated. Their deaths bring the country's death toll from COVID-19 to 47. 2 other deaths in COVID-19 positive patients are currently under investigation. 37 new recoveries were noted over the reporting period. 1,684 cases are currently active and 53 persons with COVID-19 have died. 4,627 cases of COVID-19 and 2,890 cases, that should be recoveries, have been recorded in St. Vincent and the Grenadines since March 2020. Depressive episodes, anxiety, and suicidal thoughts are some of the mental health issues that have been observed in some persons who have been in COVID-19 quarantine for 14 days or more. This was noted by Counselor in the Ministry of Health, Wellness and the Environment, Alika Matthews, on SVG-TV's Viewpoint program last evening. Matthews used the opportunity to encourage persons who are in quarantine and are experiencing mental health issues such as suicidal thoughts, panic attacks, depression, etc., to call and seek help.
And they find that they're not engaging in activities that they would have previously enjoyed. They just don't want to do anything. So let's say, even though you're not able to go outside and run up and down, you are a person who was able to watch TV, or you like to cook or something like that, and you just find yourself wanting to lay in bed every day. You don't want to engage with other persons. So even though me, your friend, I'm calling to check in, you don't want to have a conversation with me. You're just sitting there and you're looking at the phone ring, and you're just letting it ring. Persons, no matter what you do, you just feel exhausted and tired. Sometimes that can be your body manifesting in a physical symptom that you're just mentally exhausted. Irritability. So maybe people calling you, and instead of answering the phone, you're fussing. Why are they calling me? Why are they doing this?
Angry for nothing.
Like I said, in the more severe cases, person might have suicidal ideation. I can't do this. I just cannot stay in this house for this period of time. And that is a definite reach out for assistance.
Matthews further cautioned about the dangers of drinking and smoking habits that some persons might develop to cope with their current situations.
If you're using excessive drugs, so you're at home, you're by yourself, and you have this as the 3rd bottle of wine. You send out to the supermarket
for the day,
and the full list just saying wine. Bring me about 3 bottles of wine, and that's all you want to do. Sit and drink or sit and smoke and engage in these activities that is going to have a negative effect on your body, because there's only so much you should drink or consume. before it's considered unhealthy. So these are some of the things that you can look out for in those instances.
Okay.
The councillor said the best coping mechanisms for persons who are in depressive states in quarantine are to get out of bed, take care of your hygiene, exercise, eat properly, find ways to build yourself, and stop worrying.
In the house, YouTube has a wide variety of exercises that you can do. Get some movement. If you live in a house by yourself, utilize the space that's there. You have a yard space that is fenced. Go out into the yard, get some fresh air. Get up, cook, do something with your life. Don't just sit there and, like Ms. Thomas said, worry, because you're going from news article to news article. You're watching St. Vincent numbers, you're watching Grenada's numbers, you're watching St. Lucia's numbers, and how many people are dying. Don't just do that. Get some exercise, eat properly, find ways to build yourself.
This month is being observed as Breast Cancer Awareness Month, and for the second year due to the COVID-19 pandemic, no major activity will be held in commemoration, such as the Pink Cap City Walk. As we hear in this report by Larissa Pugsley-Kidd, the SVG Medical Association, which has been hosting the activities over the years, says the pandemic is affecting Vincentian women's breast cancer treatment access.
Women continue to suffer and die from breast cancer around the world, and Vincentian women have not been spared. President of the SVG Medical Association, Dr. Rosalind Ambrose, said the COVID-19 pandemic has further affected lives and livelihoods for many, noting that monies raised for activities held annually in observance of Breast Cancer Awareness Month have been stalled due to the pandemic, hence affecting the association's ability to assist those who need the support.
As the pandemic has sort of become a priority, well, certainly it is more medically urgent, and because of having to shift resources, some women were not able to either continue on. There's been a break in the management chain, and so that has affected a number of women across the world adversely in terms of keeping up with their treatment.
Persons with breast cancer usually have to travel overseas to access treatment. Dr. Ambrose lamented the high cost for these treatments.
Try to support women with when they're able to travel, airfare, with the laboratory test, and contribute to the treatment things. Now, a lady spoke with me during this week, and one of the medications, the chemotherapy agents that she used to get, is $4,000 for one cycle. So certainly the fundraising that we do, and she typically will need about 8 cycles. So typically our fundraising couldn't possibly support that woman entirely and still help other women. So this is why we try to do the ones that are more manageable.
Dr. Ambrose is looking for partners to support the SVG Medical Association to help provide treatment for breast cancer patients here in SVG.
If there are any patrons who wish to just contribute to our breast cancer program, we welcome that as well, because we still need to support these women. And as you see, even though the pandemic has been going on, new cases of breast cancer have also happened, and so we still need to support these women and continue to build our program.
Despite the financial challenges, the SVG Medical Association continues with its early educational campaign on breast cancer.
Physicians in the general practice and all our areas of medicine is to continue to educate women one woman at a time about breast cancer and the need to do self-examination, the need to have a mammogram, and to follow up with their healthcare provider if there's further investigation.
Breast cancer is the second leading cancer globally, and here in St. Vincent and the Grenadines, it is reportedly the leading cause of death among women. For SVG-TV News, Larissa Pugsley-Kidd.
Showers and thunderstorms are expected overnight into tomorrow from a tropical wave. That's according to the manager of the St. Vincent and the Grenadines Meteorological Services, Billy Jeffers, while speaking on NBC's face-to-face program this morning. Jeffers used the opportunity to remind residents, especially those living close to river valleys, to exercise caution as lahars or mudflows remain a threat.
Synopsis we have today is a tropical wave that will be affecting St. Vincent and the Grenadines. When the analysis was done, it seemed that the rainfall activity is likely to peak later on today into tomorrow. So we are likely to have intense showers. There's a possibility of thunderstorm also in the forecast. So my advice would be, well, for residents, particularly once you're living in the valley of the volcano, to exercise due care and pay very close attention to the update on the forecast.
Though the peak of the hurricane season has passed, the Met Services manager is appealing to Vincentians still to exercise caution.
What we will do, we will analyze the historical data sets, and specifically what we'll look at the daily average number of active storms and hurricane during the months of the hurricane season, of course, June to November. What happens is that we arrive at the 10th of September as the traditional peak of the season. Now, if we were to plot a graph of the data sets, what we will see is from just around the 10th of August, we'll get exponential growth until we reach the 10th of September. 10th, of course, being the peak, being the apex, and thereafter we'll be on the down slope of the curve. So we are pretty much on the downside of the on the curve as it relates to the formation of storms and hurricane. But we just made a point a while ago that we are in our wettest month. So not because there's a lower probability of storms and hurricane forming in the next 2 months, we are likely to have above normal rainfall.
Jeffers said thus far for the 2021 hurricane season, the only significant damage to SVG came from Hurricane Elsa in July.
In terms of storm and hurricane, we were impacted by Hurricane Elsa on the 2nd of July. The eye of Hurricane Elsa actually moved directly over northward. Well, the all clear wasn't given to residents as yet to move back following the last of explosive eruptions in April. But those who remain, they would have experienced a significant brunt of the hurricane force winds. Now, as we know, damage was reported island-wide. We had a lot of downed utility poles, damage to infrastructure, particularly in the North Windward area. Also, we had flooding, and then, seismic also reported lahars from this event. So for St. Vincent, this was the only tropical cyclone that directly impacted SVG.
The manager of the SVG Meteorological Services say they will continue to monitor the approach of the tropical wave, that should be the approaching tropical wave, and provide necessary updates. Minister of Agriculture Saboto Caesar is encouraging the nation's youth to join the agriculture and fisheries chain, noting that they can become a food producer to ensure lives and livelihoods are maintained. Minister Caesar was at the time delivering the feature address at a virtual ceremony on Saturday held in celebration of World Food Day under the theme, "Our Actions Are Our Future. Better production, better nutrition, a better environment, and better life."
We are still searching for an exceptional cadre of multi-talented and multifaceted young persons to join the agriculture and fisheries value chain. We are evolving in a very unique environment, and I say this from the standpoint of reflecting on our history, and I wish to bring our listeners to the awareness that it is the first time in our history that we are exporting goods from our country, from our sub-region, in the absence of trade preferences.
Speaking further on food production in SVG, Caesar noted that despite their challenges, food producers remain steadfast and resolute to ensure that food is available, accessible, and affordable.
And when you look at the context of today, the vagaries of climate change, the COVID-19 pandemic, the rising prices internationally as it pertains to shipping, these are many of the issues that we continue to grapple with as stakeholders in the food production sectors.
The Agriculture Minister noted that in St. Vincent and the Grenadines, there is a well-founded, diversified production platform with 4 important fundamental pillars of growth.
We continue to witness expansion in the livestock subsector. And in 2022, we are going to see further advancements as we work with livestock producers, not only in St. Vincent and the Grenadines, but with stakeholders internationally, to ensure that issues of production and marketing are properly addressed. We continue to witness the expansion of the fisheries subsector in St. Vincent and the Grenadines. And the blue economy will continue to play a pivotal role in our economic growth.
Meanwhile, the Minister of Health, Wellness and the Environment, Sinclair Prince, is encouraging citizens to eat the foods they grow, which he says are high in fiber and low in fat. Addressing the virtual World Food Day ceremony, the minister said the diet of Vincentians has shifted over the years from a more healthy eating habit to an unhealthy pattern, which results in many communicable diseases and other health issues.
It was customary in the past to walk through the streets of St. Vincent and the Grenadines and observe vendors displaying vibrant, local and fresh produce for sale. However, the diet of Vincentians has shifted away from the indigenous diet to a more unhealthy eating pattern, consisting of high levels of sugar, salt and fats, causing a rise in the number of citizens diagnosed with non-communicable diseases such as diabetes, hypertension and other associated health conditions.
Minister Prince said that the ministry has invested in several projects that are designed to increase healthy eating and sustain rural livelihoods to help improve household security and public health.
The main aim is to improve the quality and diversity of the diet of population in St. Vincent and the Grenadines. This will be done by engaging stakeholders in designing, implementing, and evaluating packages of intervention to address key issues within our food systems. So, as we commemorate another World Food Day, let us resolve to eat healthy, even as we push for the continued achievement of food security here in St. Vincent and the Grenadines.
The health minister further spoke on the global and regional initiatives which have influenced the national drive in making St. Vincent and the Grenadines a food and nutrition secured nation.
The commitment of the government of St. Vincent and the Grenadines is shown as it continues to build on the existing mechanisms for achieving food security, addressing NCDs and guaranteeing citizens the right to food. Right to food, particularly for our children. But the government has signed on to the FAO's Sustainable Schools Initiative and is currently in the process of updating and rolling out the Food-Based Dietary Guidelines, the FBDGs. These guidelines must be stressed as it will form the basis for our food and nutrition policies and education programs, promoting healthy eating habits and improved lifestyles for our nation's people.
Close to 4,000 farmers affected by the eruption of the La Soufrière volcano will continue to receive the financial support promised by the government. Farmers have been complaining that they have not been in receipt of this support after the last payment in August. However, on radio yesterday, Prime Minister Dr. Ralph Gonsalves said Cabinet has decided that the farmers will receive the financial support every 2 months.
Should be paid sometime between the 22nd and the 25th of this month before independence. This is the payment, $500 a month for the farmers for the months of October, for September and October, and then in December, just before Christmas, we will pay again for November and December. $1,000 we're paying with 2 monthly payments. That's how we're doing it, to lessen the number at the time for COVID now.
The Prime Minister added that farmers who did not receive any money from the first tranche will also receive their payments in full for all outstanding months.
And by the way, for those farmers who had problems with their identification cards earlier and didn't get the payments for July and August, they would also get the payments. So some will obviously get $2,000 and some get $1,000. That bill is about $5 million. All that was in our supplementary appropriation bill consequent upon the La Soufrière volcano.
PM Gonsalves said other support from the government continues to volcano-affected persons.
We are currently paying the workers who the nearly 6,000 workers $2.5 million. They're almost finished paying on the windward side. They'd finish on Monday, and then on the leeward side between Monday and Wednesday, their monies. We released significant monies to Bragsa to deal with the issue of the ash and some other work. Another over $6 million for some other set of capital projects.
Residents of Fancy have returned to the community located close to the flanks of La Soufrière in the red zone to continue their living. As we hear in this report, for some residents, a normal life has resumed, while for others, things have not been the same.
6 months after the eruption of La Soufrière volcano, the majority of residents of Fancy in the North Windward area have returned to their homes. Fancy was the only community in the red zone that did not feel the full impact of the eruption. However, damage is still evident. We were in the community on Sunday where some semblance of normalcy was observed. Roads were cleaned, utilities restored, and some residents were hanging out at the riverside. Bottled water and food items are, however, still being provided to residents. Carletta Thomas said she has not returned fully to the community, noting that her house is not the same.
Break the window, which you could see. My door cannot close. When the night come, I had to sleep with it half open. It swelled from the rain or whatever. It can't close. It crack up and this and stuff like that. I lost my space saver in my house, my matches with ash and things like that.
Another resident said she was in a shelter and only returned 3 weeks ago. Like Thomas, she also lost some household items as a result of the volcano eruption and Hurricane Elsa.
Push it up since they come, and all the ash fell on the bed. So we throw the matches, is not this one. We throw the matches down, the pillow them, we burn them up. But we come in little by little, we clean in our homes, even the window there, I do not know if it's from the, wherever break it, if it is from the Soufrière, the stone hour, and I have a next one break.
Some of the elderly men in the community complain about the food they are now being forced to eat.
They only tell the youth, all of them, Mr. Man bring some good food guy, even some linseed peas and some Irish potato, and but pure rice and out of a chop of home. Until I shoot. He ugly, he man them ugly, and they they'll kill all the people after they'll take them and make joke with them.
With me, the personally, I got to be back home. But for time reach home, I don't know where to start from there. Because I come make a job, new starting.
Another man said he is yet to replant his crop as the conditions are still not suitable.
Right now, garden thing. No start to work back no garden yet, and then
Fancy is the closest community in the flanks of La Soufrière volcano. For SVG-TV News, Larissa Pogsley Kidd.
The St. Vincent and the Grenadines Environment Fund, SVGEF, is working along with the Sustainable Grenadines Incorporated, SUSGREN, to implement the second phase of a project dubbed Protecting Ashton's Lagoon Biodiversity through the Eradication of Invasive Species. The second phase of the project involves the eradication of rats on Frigate Island to protect the biodiversity of the Ashton Lagoon. The work on the second phase of the project, which is estimated to cost $19,035 US, is being done after a biodiversity survey for Frigate Island conducted in May this year found that the presence of rats on the island is deleterious to the fauna. A news release announcing the commencement of the work on the second phase said the process of rodent removal will be ongoing since Frigate Island is currently connected to Union Island via a causeway that presents a permanent access. That should be a permanent access route for rats from Union Island. The SVG Environment Fund says it is pleased to be associated with SUSGREN and the SVG National Trust in the preservation of Frigate Island.